Our top focus this morning, the coronavirus situation, the alarming coronavirus situation in the United States. The top US health expert, Dr. Anthony Fauci, has said that the country is on a steep slope as the COVID-19 cases continue to rise following the Thanksgiving holiday in America. In an interview, the director of the National Institute of Allergy and Infectious Diseases voiced his concern about what he called a precarious situation.
So I think we're going to be faced with another situation. We're going to have to make decisions as a nation, state, city, and family that we're in a very difficult time, and we're going to have to do the kinds of restrictions of things we would like to have done, particularly in this holiday season, because we're entering into what's really a precarious situation because we're in the middle of a steep slope. You know, when I tell what people need to do, we say it over and over again. We know it works, but also that there is, as I mentioned to you before, Chuck, there is light at the end of the tunnel because we will really be seeing vaccines soon. We likely, almost certainly, are going to be vaccinating a portion of the individuals in the first priority before the end of December. And then as we get into January and February and March, more and more. So if we could hang together as a country and do these kinds of things to blunt these surges until we get a substantial proportion of the population vaccinated, we can get through this. There really is light at the end of the tunnel.
Americans defied pleas from the state and local officials to stay at home during the Thanksgiving holiday. This as the COVID-19 cases in the country continue to spiral out of control. A number of healthcare facilities say that they are at their full capacity. The United States has reported more than 13 million cases of COVID-19, which is currently the highest in the world. More than 273,000 people have lost their lives due to this infection. Dr. Fauci urged Americans to continue to use face masks and practice social distancing. As a vaccine against COVID-19 is now on the horizon, Fauci noted that there is a light at the end of the tunnel. Let's get you some more updates on the COVID-19 situation in the U.S. We have our correspondent Jagriti Dave joining us live from Washington. Jagriti, thanks so much for joining us. Millions of Americans are heading home after the Thanksgiving holiday, of course, and subsequently the COVID-19 cases have topped more than 100,000 new cases for the 27th consecutive day. Now, Dr. Fauci has given a warning about the unprecedented surge. So give us a sense of the situation on ground in the U.S. as far as the coronavirus situation is concerned.
Well, I think you summarised it very well. What we're seeing, according to Johns Hopkins University, is more than 13 million cases and more than 266,000 Americans who have died from the coronavirus. And the number of cases, daily cases and number of hospitalizations continues to soar with huge concerns about facilities reaching capacity. And despite these numbers, which did stop some Americans from travelling to see family and friends over Thanksgiving, around 50 million Americans were expected to have travelled over the Thanksgiving holiday. And looking back at previous holidays, from hindsight, we know that there have been spikes in the number of cases after major holidays like Memorial Day, where people did get together despite the pandemic in full swing. So there are these concerns that health officials like Dr. Anthony Fauci are articulating, and those concerns are going to continue as we look ahead to the Christmas holiday as well.
Right, that actually brings me to my next question. The situation is quite alarming in the US as of now, and the holiday season has just started with Christmas and New Year's coming up. So what are some of the biggest concerns of the medical experts as hospitals, as you just said, are running at full capacity?
Well, that's it. What they're worried about is that the number of cases continues to rise and the number of hospitalizations rises with it, which means that there is going to be, at capacity hospitals that they are going to struggle to keep people, to ventilate people if they need to. And so those are some of the concerns. I think hospitals and health professionals don't want to end up in that situation that the US found itself in April, May, that time where we had that first surge surge and we had those awful stories of deaths and the number of deaths peaking at that point. That is what the sort of thing that they want to avoid. And of course, with the news of a vaccine potentially being approved, we still have to wait for the FDA to approve whether they're going to be in discussion. The vaccine committee is going to be in discussion on the 10th of December to see whether they're going to approve Pfizer's vaccine. That people, health professionals don't want Americans to lift their foot off the gas pedal when it comes to social distancing and wearing masks.
Right. My final question, Jagriti, as the incoming Biden-Harris administration begins to take charge, it is now evident that its biggest challenge and inheritance, so to speak, will be the COVID-19 pandemic. So do we have any sense of the kind of measures that may be put in place in the new year?
So it is very clear, I think, from the language of the Biden administration that the coronavirus pandemic is their number one priority. It was front and center in pretty much every speech that Joe Biden gave after the news networks called the election for him. He has been, even during the transition process, even before President Trump approved the General Service Administration to hand over resources and funding to the transition team, when Joe Biden was effectively doing this on his own, he was talking to health experts and working out strategies for handling the pandemic. And one of his concerns was that by not having contact with health professionals, by not having the official transition process underway, working with federal agencies, etc., that he and his team would be hampered from taking part, from fully being able to undergo the vaccine distribution that would be needed after January the 20th. That would need to be continued to be done after January the 20th. So I think vaccine distribution is probably front and center of the Biden administration's mind. That handover that he is now receiving from most federal agencies and from health experts. I think that is what they will want to continue rolling out if the FDA give approval to a vaccine by mid-December.
Right. All right, Jagriti, thank you so much for joining us on this broadcast and for all your insights.